Researchers across the country, including in your area, are conducting a study that could include you or people you know. The Prehospital Analgesia INtervention trial, or PAIN, is a study that will look at whether giving fentanyl or low dosage of ketamine for a patient who is in pain and mild shock from a trauma before arriving at the hospital will increase survival and lessen bad side effects. Fentanyl is a synthetic or man-made opioid and used to treat pain. Ketamine is not an opioid and can be used as an alternative for pain medication at a low dose. When someone is in pain and shock from trauma, some emergency medical services will give them pain medication. This is usually fentanyl. Other services may not give any pain medication because the patient is in shock. Researchers think that a low dose or sub-dissociative dose of ketamine may be better at lowering the risk of death for patients in shock that are having pain. For this study, researchers will compare these groups to see if one group recovers from their injuries better than the other. Additionally, the study wants to see if there are less serious side effects from pain medication that affects breathing and blood pressure, and if one group of patients receive less opioids in the hospital or has less pain. Researchers believe that fentanyl and low-dose ketamine have similar associated risks. Any analgesic has potential risks of reaction, however, those risks are rare. Ketamine in some cases may cause hallucinations, agitation, anxiety, or feelings of disconnectedness. In the study, we're including males 18 years and older, and women 50 years and older who have traumatic injuries that cause pain and are in shock, and are being transported to a participating hospital in an ambulance. Once the patient arrives at the hospital, researchers will collect information from their medical records as part of the study. Some patients may be contacted after their injury to see if they have complications such as opioid use or dependency, anxiety, and PTSD. Because treating pain when a patient is in shock is an emergency, there may not be time to get consent before receiving pain medications as part of the study. Most people would be too severely injured to give informed consent, and families are usually not available in time. Researchers will notify people enrolled and give them detailed information about the study as soon as possible after they arrive to the hospital. For more information, please visit our website at lightsnetwork.org/pain. Any opinions or recommendations expressed in this material are of those of the author and do not necessarily reflect the views of the Department of Defense.